Welcome to our panel on looking after the mental health of your workplace. Following up on the theme of a healthy workplace, we thought that the issues of mental health are particularly high on everyone's list right now because we're all dealing with more of these issues. And as you heard from Dr. Kondra earlier today, there really have been increased stresses on people over the last few years, and it's resulting on people feeling more mental health challenges. So this program is going to be, we're not going to talk about any cases, but we're going to talk about sort of overall themes and practical approaches to dealing with some of the issues that arise when you're dealing with, trying to support your employees to have a healthy workplace mentally, or what happens when you see people that may be in a bit of a crisis or really not functioning well because of mental health issues. Joining me on the panel today, we have Zainab Youssef from Toronto, Nadia Timochenko, also from Toronto, and Veronica Rosshaus, who joins us from our Vancouver office. And me.
Yeah,
I'm
and
Lisa. So I thought maybe first things first, that we should talk about how do you recognize when an employee might be dealing with a mental health issue? How do you recognize the signs of that? So Nadia, could you give us some tips for how an employer could recognize where they might be dealing with a mental health issue?
So I think probably one of the best things is to keep dialogue with your employees and have a sense of how they're doing from day to day just by discussing things about work and getting a sense of their general mood. But if you have a specific concern, apart from somebody actually coming forward and identifying that they're struggling with their mental health, there are some signs that may present themselves. Changes are the most significant way that you can identify that somebody might be struggling, whether it's changes in their work product, changes in their attention, their ability to concentrate, their ability to converse. Sometimes it's absenteeism, and a lot of people will have changes in emotions if they're suffering from a mental health issue. I think, discussing how they're doing, how they're feeling generally, just as part of your everyday touch-in with employees is probably a really good sign. People obviously have different emotions from day to day, but you're looking for things that are uncharacteristic for that person, and things that might signal that they're not coping as well, or they're not dealing with things like they typically would. So maybe they're not bringing forward questions and ideas the way that they might. And then there are some really significant issues. So certainly if somebody is talking about self-harm, or if somebody is saying something that is frightening, or somehow identifying that they are hopeless, those are all very significant signs that somebody may be in distress. And then there are signs that somebody may be under the influence of something that is impacting their abilities. So slurred speech, hygiene issues. Sometimes that also presents when somebody is really in a negative space and requires some assistance. I think that one of the things that you're looking for is stressors that are continuing to demonstrate themselves, that aren't characteristic, and that are not resolving in very short periods of time. So any of those things are signs that you needed another conversation. You need to maybe have a conversation with them about how they're doing and probe a little bit.
Thank you. And for those of you who heard Dr. Kondra at lunch, I think he echoed that same idea about the need to communicate with people empathetically if you think they might be in need, and talk to them about it. And I know it could be an awkward approach to take. any suggestions for how you would approach such a conversation?
Sure. I think recognizing that there continues to be in society a real stigma about mental health is important, and the way that you speak with somebody should be compassionate, generally interested in how they're doing. And I think if you demonstrate that on an ongoing basis, it's not as difficult if you believe somebody's in distress, because you have those conversations on an ongoing basis. How is your day? How are things going? And then you can probe a little more deeply about whether they are having any struggles with work or home life. Is anything bothering them? You can identify that maybe that they have missed, for example, appointments, or they have been coming in a little irregularly, or they've been absent, and have a discussion from that discussion. I think the most important thing is that you're compassionate, that you're approaching it with some empathy, and you're not approaching it in any way that suggests that there's a discipline issue involved. It's trying to gauge and understand why the behavior that you're seeing is manifesting, and identifying that behavior and bringing it to their attention that it is a concern for you.
Great, thank you. Yeah, so like not rushing to judgment, really, I guess.
No, you're not, unless you are a doctor, you're not doctors.
Yeah.
So you can identify symptoms. Although I wouldn't even want to use that language. I would want to use language that's connected to the workplace. So identify things that they're usually not doing, but you've noticed as different and perhaps troubling, or different than what their typical routine is, what you can usually expect from them. So all of those things that are a much lower level. I don't think you want to pathologize anybody. I don't think you even want to suggest that they may be struggling. I think you want to identify what you're seeing and ask the question, is everything okay? How are things going? Is there something that we can do to support you? I've noticed. Those types of phrases, I think, are good ones to lead into a conversation and help that person feel safe to come forward with more information for you.
Yeah, that's great. And you know, sometimes there might be an underlying thing, or you might find out there's just something like finite, something they've just, like, we had to put my dog down this morning. I actually had that conversation with someone within the last month. And so it's a momentary sadness, but a healthy and normal reaction to something bad that's happening, but that's discrete.
I think recognizing as well, Lisa, that it doesn't necessarily come out in one conversation. Sometimes these are ongoing issues that people are struggling with and don't recognize and don't even know how to articulate. And so making sure that you are in communication and checking up on people and how they're doing on a regular basis gives them that space to even self-reflect, to say, yeah, you're right, I have been late 3 times and I'm really struggling to get out of bed in the morning. I'm really sorry. And then that's another conversation that you can have with them. So making sure that that's open and continuous conversations about their well-being and how they're doing. So.
Yeah, I think I may be jumping ahead a little bit, but that goes to creating a culture of, like, a healthy culture in your workplace when it comes to mental health, is ensuring that that conversation isn't the kind of thing that only arises when an observation is made, but rather that you are fostering an environment that is empathetic generally, and that you are paying attention to and observing how your employees are doing on a regular basis, as opposed to just when something is witnessed as being off or not meeting expectations, or one of those sort of more pejorative or negative views. Instead, it's about ensuring that your managers, your supervisors are constantly in contact with the workforce in order to ascertain when behaviors do differ, because that will present in a variety of different ways. And none of us, following up on what Dr. Condra said, none of us knows what anybody else is going through. All we can do is observe how each other are doing in our own spaces.
Yeah. I think, Nadia, you mentioned a change in behavior. I think
Yes.
that's really significant. You may have someone who always came in late all the time, and an absenteeism has been a long-term problem for them, and you're going to deal with that in more in a disciplinary sense. But when it's I think a marked change in someone's behavior, their usual behavior, that's when it might ring some alarm bells for you. So obviously, if there is someone suffering from a mental disability, we all know that that fits within the definition of disability in the Human Rights Code, and so it may, whatever issues are arising might give rise to a duty to accommodate. Veronica, what can you tell us to help us understand what is a huge topic, and we've talked about in several listeners, but in this context, about the duty to accommodate, just briefly.
Well, first, the duty to accommodate means that sometimes it's necessary to treat someone differently in order to prevent or reduce a discrimination. And in those cases, the duty to accommodate may require an alternative arrangement to be made to ensure that that person can fully participate. And that takes on a whole host of different appearances. And I'm not going to get into the undue hardship question that was dealt with earlier today in another session. So those of you who didn't attend that session, feel free to watch it back when all of these are posted. But for now, just dealing with the duty to accommodate, an example of a physical duty to accommodate would be if you have someone in your workplace who uses a mobility device, you would install a ramp or some method for them to access the workplace. And that is a different treatment to allow them to participate fully, allow them to access the workplace. So a duty to accommodate in the context of a mental disability may be something sort of a physical nature. So there may be an accommodation of a support animal, or there may be an accommodation of a quiet workspace, or it may be something that is not of a physical nature, like providing time off in order to go and seek treatment, or modifying work hours. So that duty to accommodate, again, is not about treating everybody equally, but it's about differential treatment that is aimed at allowing people to participate equally. And so when there's a mental health condition, it can become a little bit complicated and complex when it comes to ascertaining whether there is that duty to accommodate. And Zainab and I were speaking about this earlier today, and we're both of the view that the pendulum seems to have shifted. A few years ago, it was that every time anybody walked into a manager's office and said, I have been diagnosed with depression, they immediately were, the manager immediately became flummoxed and would immediately offer the accommodation. And now it's a bit more about asking the pointed questions, and we have to find the sweet spot between the two. And the human rights legislation in Canada that protects employees against discrimination on the basis of mental disability also gives us some guidance as to what is required in order to demonstrate the need for an accommodation, in order for the employee to demonstrate that need, and for an employer to ensure that that need is being met. And establishing that prima facie entitlement, according to the law, requires sort of, there are two questions. One is specificity, so name the thing: anxiety, depression, post-traumatic stress disorder, whatever it may be, addiction, there's a litany. And the second question is one of substance. So what are the facts underlying the thing? Is it simply, I am quite depressed today because I had to put my dog to sleep, and that was very sad for me, and it was triggering, but it's only going to be today? Or is it something that requires an accommodation on a more long-term basis? And that's where the substance comes in. And so we've moved a little bit from the specific, so from the name, to the substance. And that's sort of what we're looking at. So an employer's duty to accommodate will be triggered when both the specificity and substance questions are answered in the affirmative, and that demonstrate that there is that need and that requirement to accommodate an individual's diagnosis. Not asking what the diagnosis is, obviously, but understanding what the individual's needs are. And it's not simply attending at the workplace with a note that says, I have been diagnosed with depression, which is a identified diagnosis under the DSM. Are we at 7?
I think it's 7.
5? DSM 5.
No, I think it's 7. Isn't it? I thought it was a VI, that's 6. Sorry, I'm really bad with Roman numerals.
DSM 5, we'll call it 5. So it is a recognized disability or working diagnosis under the DSM 5, but it has to be something that also mandates and requires and militates in favor of the accommodation. So requiring that substantive piece in order to both provide the employer with the amount of information it needs in order to substantiate the accommodation and to determine what the appropriate accommodation is, obviously in concert with treatment teams and the individual. Or alternatively, to see how you can, as an empathetic employer, just support someone who's having a rough go for 2 days because they had to put their dog down.
Yeah, and I mean, there are I don't know if anyone's ever seen the Diagnostic and Statistical Manual, is what DSM stands for, but it's about this thick, and each one of us could probably tick off 5 things in it that we would be demonstrating, none of which may not impact or impair your ability to do your job at all whatsoever. So just because you have something that is recognized and could be labeled under the DSM does not necessarily mean that it's a disability that requires accommodation in the workplace. So a diagnosis even of depression may not necessarily require any response. So, as with when you're trying to accommodate a physical disability, where, you might have the person complete sort of a functional abilities form. These are my restrictions, these are my abilities, and you can determine whether there is a restriction or a conflict with the demands of your job that needs to be accommodated, and whether you need any modification to your work. It just doesn't necessarily follow like I have something that qualifies as a mental disability necessarily means that I'm entitled to accommodation, because it might not. You have to accommodate their needs. You don't accommodate the disability, you accommodate the person's needs. And do they really have needs that conflict with their job? So part of this process that we struggle with a lot, and I know even the idea that I think when someone's asking for accommodation, you are entitled to a bit more the diagnosis than you might otherwise, if it pertains directly to the accommodation that's being sought, than you would if you were just trying to justify, an employee is just trying to justify their absence from work. We always tell you, you're not entitled to the diagnosis, just the prognosis. Here, it's an area where you can sometimes be entitled to more information as the employer. And I know one of the challenges that we often face when dealing with these issues is getting good information, getting the information that you need from the employee or from a treating health professional. What can employers do to make sure that they are getting relevant information and the information they really need?
Yeah, so I think this is actually a question that I deal with a lot. We see so many notes, right, that are quite vague, one-liners that say, so-and-so needs 6 weeks off because of stress, or so-and-so needs to work from home because,
Seen that one a lot,
whatever, right?
And my favorite, so-and-so needs accommodation and cannot work for this supervisor.
Yeah, and super, I totally get the frustration there, because it doesn't really give you information, and it takes away your rights in a sense, right? To first of all, the first point of the accommodation piece, which is getting sufficient information to establish that there's a disability, and B, assess what you can do to accommodate, right? If there are, first of all, identify whether there are functional, restrictions, limitations that are relevant to the workplace, and then you as the employer, if you know those limitations, then you can design an accommodation that works, right? What you can do is, and what we often advise our clients to do is ask those questions, right? I think, Veronica and I talked about this a little bit at the beginning. I think, when I started practicing, I felt that our employer clients were very reluctant to get into people's business. They felt like it was like, okay, well, I have a note here that says this person has a mental health issue or a disability, and the doctor's saying this is the solution, like, who am I to ask more questions? That's not really my business. I'm going to be in breach of everybody's rights if I do that. Well, there are questions that you can ask. So I'm going to dig a little deeper. I mean, some of the questions have been addressed, but I thought I would go through some of the questions that we typically ask, and which arbitrators have said are questions you should be asking in order to meet your duty to accommodate. So we do recommend, rather than leaving it to the employee to sort of navigate that process, you have to be a partner in that process. And to be fair to the employee and the doctor, they sometimes don't know what you need, right? So it's very, very helpful if you actually give them a letter that has specific questions and invites the responses, invites the doctor to give the information that you need in order to go through the accommodation process.
And even I find like attaching a copy of the person's job description.
Yeah,
100%.
absolutely.
Because the doctor is sometimes
They don't
giving
understand.
advice in the abstract.
Yeah, they don't know what the options are, what you can do, what that person's responsibilities are. So it does help them. The other challenge, other than vague notes or short notes, is that I often see is what appears to be a medical note that just writes down what someone tells their doctor to write. So you want to put the doctor in a position where they can actually consider the issues and come to conclusions on their own. They're not just noting down, because doctors are also advocates, right? So there's a, I think it's, you want to advocate for your patient, but you also have a responsibility. So if you give them the information and ask very pointed questions, I think it does trigger in them their obligation. Oh, wait, like if this employer has identified this issue, like I need to be responsible and really think about whether there's a restriction that might, factor into that.
Causing them to question their note that says, Veronica has advised me that she cannot work for the next 8 weeks. Please give Veronica the next 8 weeks off.
Yeah, those are good ones.
So,
And when you're, maybe you're going to touch on this already, and it goes completely to what Nadia said earlier, what the letter, I always think when I'm writing the letter for the doctor, and we're usually ghostwriting it for you guys to send, it's not going to come from a lawyer because that's going to send the wrong message.
Yes.
But it's all in the spirit of accommodation. We want to accommodate this, and we want to help them to be successful in the workplace. We want them to return to work as soon as possible. Here, can you
that's
please
the deal.
answer these questions to help us in the accommodation process? Because if they feel like, if they feel like it's their patient's job is at stake, then they're going to, feel like they're going to war for their patient. But what you want them to do is understand that it's a supportive environment. You're trying to do the right thing, but you need their help to do the right thing.
Yeah, that's a good point. And we've talked about this as well. Sometimes the employer feels that that person should be on a leave, and the person doesn't want to be on a leave, doesn't believe that they need it. And sometimes putting in the letter to the doctor, letting them know that there's like paid leave options or these additional supports provides that extra relief for the doctor to feel like, okay, well, my client's not, or my patient's not going to end up homeless because I've said they need to be on a leave, right?
Yeah.
So generally, employers can, ask for the nature of the illness and how it manifests as a disability. The point was made earlier that, in a lot of cases we say, you don't need, it's not appropriate to ask for a diagnosis, but when you're dealing with a mental illness, it sometimes is appropriate because we know that sometimes the symptoms that can manifest, stress, anxiety, they may be linked to a disability, but they may also be part of the normal spectrum of, human experience. So there are cases where that's the only way that you can really link those symptoms to a disability is by having a diagnosis.
Now, Zena, can I ask, would you be satisfied if the doctor said, my patient's been diagnosed with a specific mental health issue, here is how it manifests, as opposed to saying they're bipolar? They identify that they experience different symptoms and it manifests in a workplace with these types of behaviors, as opposed to actually naming it?
Yeah, I think it depends. If they give a lot of symptoms, and it gets you closer to sort of a determination that there's a disability, I think that would be appropriate. My only concern is like the term mental health issue is so broad that I don't know if it would always meet the definition. But that said, if you have a doctor's note that says this person's experiencing a mental health issue and is going through all these symptoms, I do think you should take an accommodation approach anyway.
Yeah.
And it may be temporary, right? So that's one of the things that we usually try to target in those letters is try to get a sense of whether what this person's dealing with is something that's permanent or something that's temporary and what the prognosis is. So are we going to expect that this is something that's going to happen for 6 weeks and then there's going to be some improvement? And if there's not going to be expected improvement, then that's something that hopefully the doctor can identify. Sometimes that's not possible, and what you would ask for is updates, right? So that's part of the accommodation process. It's usually not just one letter, right? At the end of the period that's identified, there might be a second letter, right? To see if, can we now, has anything changed, right?
Yeah. It's not a one-time process,
one-time
one moment in
process.
time. It could be changing over time.
Yeah. So the other important element to ask for is, and I think the most important one is the restrictions or limitations that flow from the disability. And Lisa pointed out a really great tip, which is include the job description always. And if there's no job description, type out what that person does, because that's really, really important. We know that employers are entitled to know what the functional limitations that the employee may experience, from this disability, and it would really assist the doctor in responding to that question if they understood what this person does on a day-to-day basis. And then one other thing that I think is important to ask, especially if you are worried about the self-reporting, that doctor note that just looks like it's maybe the person is just writing what their patient is telling them to do. And going back to Dr. Condra, he used that as an example, actually, where he overheard, a doctor ask their patient, what did you say you want me to write?
What do you want me to say the accommodation you need is?
So
I would like to work straight days only, please, and not work for that supervisor.
Yeah. So, ask for the basis for the medical conclusion. The purpose of this question is to just really hone in and again, remind the doctor, right? Have you done anything to reach these conclusions? Was there, and for yourself, right, to be satisfied that the conclusions are based on an independent and objective assessment of the employee's condition. They're not just noting down things that their patient wants them to say. So you're not going to, you shouldn't be asking to see at that stage. I think it's not appropriate to ask further than that. You want to ask the question, but you're not entitled to ask for test results, clinical notes, that kind of thing. If there's a concern about the assessment, if you're still not satisfied, it may be appropriate to think about whether an independent medical examination is something that is appropriate in the case.
Zainab, I don't know what you do, but my practice generally is also to offer to pay for that medical note on the part of the employer, so that you're not putting the financial stress on the employee, and to make it clear that any costs associated with that report or note will be borne by the employer. And that's, I think, quite important, at least in my view, simply because often these notes can be expensive and they can be cost prohibitive, and physicians will feel more comfortable engaging if they know that their account is going to be paid not by the individual that they're treating, but by the employer.
Yeah, they have to give you good information like you want. It's going to take them more time than writing the above patient cannot attend work for 6 weeks.
Yeah, and I think it also it helps the employee, because sometimes there is pushback, right, to going back to the doctor, and it's a frustrating, from their side, it's a very frustrating experience, because you asked them to get a medical note, they did, and now you're saying it's not good enough, and so now they have to go back to their doctor and ask for another note, and who knows when that's going to happen. So it does help, anything you can do to help, including, paying for that, it does, I think, make the process a little smoother. And I think, while it is not, I know some employers do this, some employers don't do this. The Human Rights Commission, I think, has in one of their policies, it's a recommendation for employers to do. And I have had cases where employees have looked this up and found it to be the case, and then they say, well, this is your obligation to do this, to support me in the accommodation process. So it's, I would call it a best practice.
Agreed.
I think.
We talked, when we were preparing this, we talked about a case that I had years ago where an employer was really concerned about the mental health of one of their employees, who had, so it started with kind of a harassment complaint that she made to HR because she thought that the IT people were like snooping on her computer. So they looked into that, they took it seriously, and there was no sign of anything. And then it kind of escalated to like, no, they're spying on me. And then, and when I wear the headset, when I'm on the phone, you're brainwashing me through my headset. Like it escalated to things where it was ringing real alarm bells that the person probably had some sort of like paranoid schizophrenia, which of course they were not doctors and were not in a position to do, but there were definitely concerns that there was some kind of dissociative disorder going on. And of course, what you may know is that one of a common part of that syndrome is that you don't think there's anything wrong with you, it's everybody else. And so the employee refused that there was anything wrong with him. They wanted her to go to her doctor and, get help, and she refused because there was nothing wrong with her. And so what we did is when you write a letter in that case, it's really important to specify. You can't say, we think she's paranoid schizophrenic, right? We think she's seen monsters. You're not going to say that, but we put the detail, because if you just sent her to her doctor to say you need a note saying that you're fit to return to work, like the standard old ones, she would just say, my work wants a note from me that says I'm fit to work, and he would write the note and she would bring it back. So we took the time to write a letter where it said, like we detailed the things that she had reported and that we had investigated this and there was no evidence of this, and like showing just very fact-based the things that she was saying, so that when the doctor read it, they would know what line of inquiry to follow, to ask the right questions, to explore it, and then she still didn't want to go to the doctor, but in that case they actually brought a mental health nurse that came in sort of on a consultant basis and spoke to the woman, and it was so brilliant. But what she said, she was used to working with people with this kind of condition, and she said to the woman, well, like, you don't have to convince me that you're okay. I believe you that you're okay. So just go take the note to your doctor, and your doctor will sign it, and then you can come back to work. Like she just, didn't argue with her. And the woman was like, okay, yeah, I'll go and get this note. And she told her doctor, well, she never came back to work. The next thing we got were the disability forms being completed. And, she was getting the help that she had needed, and they were having trouble forcing her to go to the doctor. But if that letter hadn't detailed the things that were happening in the workplace for the doctor to read, he wasn't going to hear it from her, most likely, not unless he started asking her about it, right? So the more detail you give, the better.
Yeah, I think that's a really good point, because often these observations, right, they're not a one-time, you're sitting down with someone in 10 minutes, you've noticed all of these things, right? It's over time you notice a pattern of behavior or changes in behavior. If she just goes to a doctor and says, oh, like, I feel great, I was off work for a few days, my employer's asking me for a letter from you saying I'm fine, will you write that letter? The doctor may not know there's anything else going on, right? But if you have put down your observations, and again, sticking to your observations, not reaching your own medical conclusions, and asking those questions, particularly if the person is not, does not feel that there's anything wrong, then that gives, again, we're not making a medical conclusion, but we're alerting the doctor, like, to a possible line of inquiry that they need to take.
Right, and in some circumstances, that alerting can become an obligation, especially if that alerting indicates that there is some possibility that the individual may be a danger to themselves or others. And so in providing the employee with that information, in arming the employee with that information to bring to their physician, even if they are adamant that there is nothing wrong with them and they don't need any assistance and they're fine, and what you're observing is incorrect and what they're observing is correct, and you are spying on me and you are doing the things, then you are giving their physician the license that physician may require and may need in order for them to delve further, because, as Anna said, it's entirely possible that the physician has no ongoing relationship with this particular patient, and they may not have observed any of these things. They may not have, and if this individual isn't self-reporting any of these things to their physician, they may have no way of knowing. Many of us have very infrequent and very short visits with physicians, and so in the absence of ongoing treatment, you're providing the doctor who is in a position to make the diagnosis with that primary piece of information for them to then go down that line of inquiry, and like I said, oftentimes we're mandating that for them. There's a question over there.
And remember in that, remember in that instance, the woman doesn't think she has any medical issue. So she's not gonna, like, you might go to the doctor and say, I'm having headaches or my shoulder hurts. But if you don't think that your thoughts are irrational, you're not going to report them to your doctor as a symptom, right? It wouldn't have come up in the conversation. Yeah, sorry, you had a question.
How do you get that information to the doctor? So if I'm that patient and you give me a letter that says I've got all these wacko behaviors and I don't think I have them, what incentive is there for me to take it to my doctor? Like, how do you actually get it to the doctor?
So we gave it to the employee to take to the doctor. And and so they weren't going to let her come back to work until she returned with it.
Yeah,
and you have to put the but also we should know you're going to put a consent at the bottom of the letter and I consent to you giving this to your employer. So the doctor's not going to give it to you unless the employee signs that consent. So it has to go through. Yeah, it has to go through the employee.
And Lisa's example, where the employee was adamant that there was nothing wrong and that she was not going to her doctor, they brought in the public health nurse with that expertise who said, look, you don't need to convince me, you need to convince your employers. Like, here's the letter, just go do it. And that gave the carrot to the employee to go. And as Lisa said, that employee never returned to work. And it's none of these things is going to be easy. These circumstances are always going to be challenging and they are always going to be bespoke, and you will always have to gauge that employee and what will motivate that employee. And that goes back to what Nadia was saying about having ongoing conversations and understanding your employees and being empathetic and knowing what they will positively react to and what they will negatively react to. And I think if you have that good relationship with your employees, saying to them, look, we have observed these things, it's causing us some concern. We hear you that there's nothing wrong. We just need to be satisfied because we owe you an obligation of a healthy workplace, and we need to make sure that we're delivering on that. So go take this letter to your doctor, come back with their response. We hope that the response is everything is great. Fantastic. And if it's not, we can work together to make sure that everything is great.
One of the other things I think,
I think you're probably going to say this.
I was going to say some workplaces actually have forms that identify some of the characteristics that are necessary for someone to be successful in their workplace that are based on cognitive issues. So the individual needs to be able to concentrate for up to at least. The individual needs to multitask for at least. The individual needs to be able to concentrate. And basically, it assists a doctor who, even with perhaps a really good description of the role, can't tease out from it how that might impact a person who has a certain disability profile.
So beyond the standard physical demands analysis, one that has a cognitive aspect to it too. I haven't seen very many of those, but that's amazing. I guess if it's a job that's primarily a cognitive kind of job, they should have those as part of the PDA. That is not the point I was going to make, but I was going to ask you, a question, Nadia. Something that Veronica touched on about, the danger if the employee's a threat to themselves or others, because, I think one of the things we've learned in the last few years with an increasing awareness of mental health, the Bell Talks programs and some of the things we've read is that, every person that walks into their workplace or a school and goes on a violent rampage has a mental health issue by definition. But not every person with a mental health issue is violent, right? In fact, it's a very, very small minority of people suffering from mental health issues who are actually prone to violence, and there are symptoms of someone who might be a concern of violence. So Nadia, what if an employer does have concerns beyond the employee's ability to do the job and is worried about health and safety of the employee or others in the workplace? what should they do to navigate those concerns?
So I think you have, first of all, I'm glad that you said that most people who have mental health issues are not violent. Like, by and large, statistically, it's the same proportion of individuals in society. So it's not something that's particular to mental health. And many people who suffer from a variety of different mental health disabilities actually have a greater proportion of self-harm than harming others. I think you're looking for both. So you want to be cognizant of whether or not somebody's language suggests that they're either self-harming or that they're perhaps perseverating on something that may be dangerous. And so you're looking for those signs. There is specific training if you have a large workplace that can be provided to employees so they know what the signs and symptoms are that somebody might externalize violence. And so I think that's a really important thing. Certainly people talking about weapons, people who are extraordinarily aggressive in a moment when they're not typically, and their aggression is towards others as opposed to internalized. I think all of those things are really concerning. And when you have questions regarding someone's behavior, go to somebody who has an expertise in evaluating that rather than presuming something on your own. So I think that's the other really big important piece. There is training that you can receive so that you have an understanding of what the signs and symptoms are where somebody might present a violent threat risk. And a lot of the evidence and a lot of the professionals who provide this training really emphasize as well that there's the difference between talking and somebody who has access to weapons, somebody who has an intention to use them, and the behaviors around that and the language around that. So understanding the difference between all of those things and also differentiating that from somebody who might self-harm and who has exhibited language or behaviors of self-harm is really important. They're not linked. Somebody who aggresses towards others is different than somebody who has a proportion of anxiety and puts it out on themselves as opposed to externalizing it.
Thank you. What should an employer do in order to meet their health and safety obligations?
So under OSHA, we all have a responsibility in Ontario to do violence plans. So there's a program as well as workplace plans that need to be done. We have an obligation to reassess those workplaces if something takes place that may cause a risk of violence. A lot of them, unfortunately, are very standard. They talk about things like lighting and exits and call systems. They don't talk a lot about the kind of training that staff should, who are in a workplace that might have a greater proportion of risk, and that's one of the key things, I think. If you have that kind of workplace, it's important to ensure that your employees know how they're actually evaluating for workplace violence and when they should reevaluate. I think that's the other significant thing. I work with school boards, and one of the things sometimes that we see is that the assessment of each school looks very much like the next school, and we're not really assessing the individual factors of a particular school because they all have the same lighting, they all have the same call systems, they all have very similar features. But really what you're doing, and as an employer, what you need to do is evaluate the risk particular to that site. That includes the number of individuals, the types of behaviors that you may have seen in the past, and certainly if there's an incident that requires a reevaluation. So it's a continuous process. It's not a one-time be done. We put in a buzzer and we're all good now. It's about making sure that you're updating and reevaluating whenever there's an incident that might have been a violent incident.
Thanks. Zainab, what if there's an employee with a known or suspected mental disability, but they're guilty of some form of misconduct in the workplace? How would an employer navigate that situation?
As with any employment situation, it will depend on the very specific facts of the case. I hate to say it, but it is true. There are some key things that you have to keep in mind. So the first question to consider is whether there's a nexus between the conduct, that you're looking at, whatever the inappropriate behavior or misconduct is, and a disability. So the challenge, that I think often comes into play here is that the employee in the particular situation may not make that link for you. And we talked about the situation where you may someone's adamant that there's nothing wrong with them, or everybody else is observing things, right? But they're not on board, or they don't recognize that they have a disability. So that's one of the challenges that could come up, is that you have not been told that this person is suffering from a mental disability, right? But there may be
I don't
warning
have an
signs.
anger problem. You people are just mistreating me.
Exactly. That's a perfect example. So unfortunately, or it's not unfortunate, but you can't bury your head in the sand and just, oh, well, they haven't used the disability word, so therefore I can go ahead and discipline, right? You have, what I think the tribunal calls the duty to inquire, right? May be triggered. If there's enough here to make you think that the conduct is related to disability, you need to be asking more questions. Another example that might actually come up in is if you've seen this before, right, with this individual, right? Like, we've had a situation happen in the past, we know that there is a link to disability, and they sought treatment, things improved, right? And then the same kind of thing started to happen. That would be a red flag for me right away to think, okay, the same thing is happening again, we need to be taking an accommodation approach. So if you get to a point where you've linked the behavior to a disability, then that's what you should be doing. You need to sort of refocus your efforts away from discipline and towards taking an accommodation approach.
So, yes, I have a question about that, because we're not doctors, and we're not diagnosing or putting some sort of diagnosis on people. So how am I then saying that these symptoms and this, or what I'm observing is that there is actually a link between this and something versus the misconduct that I'm seeing? And because I'm like,
Yeah, it's not, it's totally, that's a really good point. It's not your job. It's not your job to diagnose a person with a disability. That's for a doctor to do, right? To tell you that this person is suffering from that. So I think you have to go back to I need to involve a medical health professional.
Yeah.
And as you said, you have a duty to inquire.
Yeah.
So Nicolette, you have to you can't just assume it's coupled behavior and discipline, but you would have to talk to the employee and say, is there something else going on here?
right, okay, so that's what I was going to say.
Yeah.
So being provocative, we're in the discipline.
Yeah.
And I'm saying, hey, you can't throw stuff at people. Is there something that we should be aware of? Do you need some kind of support? Because this is just not appropriate either. But I'm not necessarily, I guess what I'm trying to get at is a comment around being able to separate the disability from the performance issue, but unless you have knowledge already of there being some form of disability, then while you might suspect,
Yeah.
you don't know
Yeah.
then you have to respond. And I'm using violence because it's like Columbia Street, but
Yeah, well, that's going to lead to discipline normally, right? Yeah.
you have to respond to the performance issue or the misconduct or whatever it is.
And by the way, even if there is an access to a disability, it doesn't necessarily mean that you're going to, the accommodation is you're going to accept that behavior in the workplace, right? You're still going to take appropriate action in response to end it, but you might take more of a rehabilitative approach rather than a discipline approach, or a hybrid, really.
Yeah.
There could be this is completely unacceptable, it can't continue, it can't be repeated, but we're prepared to help you get some help or support you while you get the help you need so you can meet our requirements.
And here's your last chance agreement.
Yeah, and because the one thing, remember in the duty to accommodate in the Human Rights Code is to the point of undue hardship. And the one thing that the tribunal seems to be pretty strong on as something that amounts to undue hardship is when it's a health and safety risk, right? So that, you don't have to put up with someone's behavior that is causing a danger to others in the workplace or themselves.
Yeah.
And that includes mental harassment and being yelled at, not just, physical health and safety.
And sometimes that kind of behavior has nothing to do with the disability,
Exactly.
right?
And there
So
might not be that nexus.
don't stereotype, don't assume. Even sometimes someone who has dealt with a mental health in the past, that doesn't necessarily mean that their current conduct is somehow related to that.
It's not an excuse to do whatever they want.
Yeah,
It's not a
an
license.
excuse. Yeah.
I think it's really important to remember in those circumstances that your obligations under OSHA and under workers' compensation legislation is to provide a safe and healthy workplace to all of your employees. That includes the person who may need an accommodation as much as it includes the person at whom that individual is throwing things. And you just need to make sure that that is what you're providing as an employer, and you're providing it to everybody who enters your workplace. Because if you're not doing that, then you're in breach of your obligations under statute. And you have to just, I think, sometimes take a step back and remember that that is the overarching obligation, is that your workplace has to be safe for everybody who enters into it. And if somebody is making it unsafe, then it is incumbent on you as employer to ensure that you're doing what needs to be done in order to make it safe. And if that means removing somebody from the workplace, then that has to be the step you take.
Yeah, it's going to trump it, right? And whether it's on a permanent basis or maybe it's a temporary basis while they get some help, you don't know until it goes through that analysis and you bring in maybe a health professional. But yeah, it's not, I think the point we really want to make is there an nexus? If there isn't, proceed as usual with discipline. If there is, then you may have to modify your approach to recognize that they need some help as well.
And I think you have to be flexible too, because sometimes that nexus doesn't happen at the ideal time at the outset, right? Sometimes it happens when you're about to hand them the termination letter.
Sometimes it happens at the arbitration hearing, and it didn't even get raised in the step 2 meeting. Sorry, you had a question.
Yeah, I was just saying, let's say a person is with a mental health issue and has gone through the process of short-term disability, leading to LTD, and that is a significant amount of time, let's say a few years. At what time frustration comes up?
So it can arise. It doesn't always arise, but that's, once again, a very individualized assessment. If you get told that something's permanent, just like a physical permanent disability, then you're in a position to decide at that point if someone's contract has been frustrated by their disability or not. If it's something that's changeable, you're going to have to give them a lot longer. We used to always look at 2 years as kind of it's certainly a time to undergo that analysis, and you may decide it's too early to decide based on whether the person's condition is static or could still potentially improve, which is coincidentally the same time usually your LTD policy of definition of disability will change from ONOC to any OC. And if they're meeting that and it looks like they've reached maximum medical recovery, to use more of a workers' comp term, but it could happen psychologically as well.
The doctor's responses are still very broad, let's say after 2 or 3 years. Still, it's
Their favorite word is indefinite, which I find some of our clients think means permanent, but it doesn't. Right? It just means I can't say for sure. Maybe they meant it to say permanent. So then you push back to us, do you mean it's indefinite like it's going to go on forever, or do you mean indefinite like you can't say it might last another 2 weeks or it might last another 2 years? And push back, because they use that word a lot.
recommendation that you gave regarding the letter with a couple of probing questions. Is that one of the
Absolutely.
Absolutely, and around the 2-year mark. If you have a case where you think it might be possible to argue that there's a frustration of contract, then we can help. Usually our guidance would be, okay, we have to get current medical, right? Always has to be based on current up-to-date medical, and here's the questions we're going to ask, and those are the questions that are going to give us the ability to make that determination.
And it's a good time to reach out to the employee who may be on leave and say, look, we're reviewing our employee files, and your leave is expiring or whatever. just checking in, when are you planning on returning to work? Do you have a return date? Should we be working on your GRTW? And they'll say, no, I'm still off. Great, well, we're gonna send you another questionnaire for your physician to fill out. And one of the questions can be, in your assessment, is this a permanent, or what is the prognosis for future recovery?
Just conscious, Mary, how are we done? We're done? Okay. We have lots more questions, but it's such a good discussion that we, of course, took more time on these ones. Are there any more audience questions? We're happy to entertain some of them. Yes?
And if they stop responding, then that would be a sign of frustration?
If they don't respond at all to your inquiries for information?
Quite like this stop.
Yeah, then we do a little bit of a letter writing campaign, right? We write to them, we say we need to hear from you by this date, then probably one letter's not enough, you're probably gonna send 2 or 3 letters, all with dates that make it clear. They start off being, no threats that we're gonna terminate you, but then if you're not getting responses, then you're documenting, we wrote to you on this day, and we wrote to you this day, and we've left these phone messages, and you haven't returned our calls, and eventually, really, there's a point where they're absent without leave, right? Whether they're disabled or not, because you're not extending the leave beyond, and you'd have to do that as warnings. And please don't say, we see these all the time afterwards, don't say, we'll assume that you've resigned, or we'll deem you, or you'll have abandoned, you'll be absent without leave, and you'll be terminated for a cause. Yeah. If you say, we'll take you to have resigned, or we'll deem you have resigned, all they have to do is write back and say, I'm not resigning, and you haven't got anywhere. So really what it is you as the employer are in a position to grant a leave or deny a leave. If they give you proper medical to support their inability to work, then you grant them a leave. And if they don't give you the proper medical or don't respond appropriately, with a lot of repeated warnings, especially if it's a mental health issue, because maybe they're not answering because they're not taking their meds and they're not in a state to appropriately respond or understand what you're writing to them. So you have to be super patient and gentle in it. But eventually what you're doing is to say, we'll have to terminate you for being absent without leave.
Yeah. But it takes a while. Like it certainly isn't letter number 1 and it's not letter number 2. You do have to paper that really, really well in order to make it stick. And
if they've been on disability, like if you know that there's something wrong with them, right? If you have someone who you don't think is ill or unable to work and they're malingering and that sort of thing, then it's a different approach. But if you're dealing with a mental health issue and you think there is something wrong with the person, then you're going to be super kid gloves, super careful, give them every last chance. Just like the insurance companies do, right? When they deny their LT, like they extend like 50 times the date by which the person has to get their doctor to put those forms in, because they know if they just say no and cut the person off, eventually they'll appeal, and through the appeal process and maybe the litigation that follows, eventually the medical documentation comes forward and the person really was sick, right? So they extend and extend and extend it. And I know it's frustrating sometimes for you. It's frustrating, and maybe the contract is frustrated, but you need to just bend over backwards to make sure that particularly when you're dealing with someone who, maybe isn't fully mentally competent to make the right decisions for themselves. Be patient. Great question. Thanks. It's a good roundup. Any other questions? Great. Well, thanks. Thank you, everyone, for coming.
Great, well, thanks. Thank you, everyone, for coming. This is the time for the draw, and I just want to take my notes with me to make sure I catch everyone in. I have a very big mixing bowl. And I want to say thank you to the panel, Zainab, Veronica, and Nadia, for participating. I think the really important thing to draw from these discussions and to remember is, like we always say to you when we're just deciding what the appropriate discipline is on misconduct, it's a really individualized analysis. It depends on the circumstances, and every case is different. Don't jump to conclusions. Don't think that because you know someone who is dealing with the mental health illness, this is the way you have to do it, because it's going to differ from person to person even. So always remember to go in a deep analysis, an individualized analysis before you make any decisions that you can't change. I hope, did everyone get a chance to put their names in? We were going to do business cards, but then we realized, do people really carry business cards anymore, especially post-COVID? It's like, well, if you put on an old suit jacket for the first time since pre-COVID, maybe you found an old card in the corner, but so we came up with the little slips this year instead. Mix them up. Zainab, will you do the honors?
Okay.
Here. I'm going to bring my glasses up. Dahlia Rotman. Yay. Oh, we have a skill testing question. I guess that's lawyers, right? You have to have a skill testing question. Let me see. I have to do it until I tell you if it's the right answer. 100 by 2, 50, 55, subtract 35. Woo! You got it. Well, if I got it right. Come and get it. You're very welcome. Thanks for coming. So this brings our presentations to an end. We hope you've all enjoyed the sessions and learned some information that can help you create a healthy workplace for your people. And remember, we're always here to support you when you're working through these issues, which can really be quite difficult, we know. And just a reminder, if you ever want some professional psychological support on dealing with some of these issues, Dr. Kondra does provide consulting services on that, and could be a good resource for that, especially for smaller employers that don't have their own in-house capabilities on that sort of thing. And even the larger ones do. Nadia was saying, like, a lot of the school boards that she represents, they have board psychologists on staff, but they can't perform this kind of stuff for people. They would still have to retain external people. So thanks for coming. Remember, if you want to, we're going to be sending an email with, I think, a link to the website where the recordings of the materials will be. So you can rewatch something or see the other panel that you missed. But also to your colleagues and coworkers who may not have been able to be, make sure to tell them that they can enjoy the materials as well. There's a lot of good stuff there, and we're happy for people to, as many people as possible, to benefit from it. So thanks for coming out. Thanks for braving the fog and